respiratory dependency.
Says, could you explain how to code for respiratory dependence? And this is, oh, that kind of looks small. Hope I didn't make that too small. It says, I have a coding question for work. I was wondering if you could explain how to code for respiratory dependence. V46.1. Should this be used only for someone who is permanently on respiratory ventilator? Yes. The answer is yes. Now, V46.2, could this be used for someone with a condition such as sleep apnea? No. The V46.2 is for somebody who is O2 dependent. Okay, so down here, if most people think that if a person is on a respirator or a ventilator, that they're bed bound and maybe an ICU. You think you see that picture of a person on a machine and stuff, which is true. But in actuality, a lot of people are respiratory dependent, and it usually is involving quadriplegia, injuries to the spinal cord, and so like this picture, this guy is actually ventilator dependent or respirator dependent, but he's in a wheelchair up moving around. There was also a picture of a girl that was going to high school, but I couldn't get it to load. Now, the other code, V46.2, dependence on supplemental oxygen or long-term oxygen therapy. Now, that would go with somebody that had something like emphysema, so in other words, without having O2 on at all times, their saturation levels go so low that they're not getting enough oxygen, and that's where you get below like 93%. Some people walk around with 94 or 95%, which I have asthma and I do. For some people that's really bad, but for me it's not. But if you dip below 93%, if you get into the 80s, that's really bad. And if you are consistent that way, then they may put you on oxygen. And you see the people that walk around with those little O2 tanks, they are a V46.2, dependent on supplemental oxygen. So it's two completely different things. Now, these are not first listed diagnoses. These are V codes that go along to help paint the picture for the care of this patient. It's very pertinent for the patient to have these codes on there. If just about every time that they're going to be seeing, a V46.2, it's going to be pertinent to their care, so that code will be used often with them. And I think that's all I put on there. It's really pretty short and sweet. There is, yep, that's it. That they're different. Just make sure you get, you understand the point 1 is for ventilator dependent, and excuse me, point 2, they're walking around with that O2 bottle, which is a prescription, by the way.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.